Right now at St. Luke's at their health system, it's in the process of opening up an additional intensive care unit. Think about that, an additional intensive care unit at a hospital. Hospitalizations are spiking and many locations are hitting capacity. A medical expert from St. Luke's says the current surge in COVID cases and those hospitalizations is more dire than the winter surge we saw back in 2020, because that was before vaccines were available. Katya Stepovic has the story.
We are seeing as high or higher critical care need than we ever have, including our pre-Delta virus surge last winter.
It's hard not to notice the sharp spike on this chart. August of 2021, setting a new record for the highest number of ICU patients hospitalized ever in Idaho. In just 1 month, hospitalizations from COVID-19 more than tripled, starting at 122 in July, up to 377 earlier this week.
We have had situations where we have been on divert, yes. If a patient comes to our ER, we are going to take care of that patient. And if we don't have a bed, we will work to find them a bed.
Last week, St. Luke's announced a pause on elective surgeries to make room for the influx of COVID patients.
All of these COVID patients that are taking up these critical care beds are also, we need to be able to get those heart attack patients into those beds and those stroke patients in too. It's this additional massive volume of COVID hospitalizations that are really putting a strain on the system. But yes, our beds are full.
Dr. Laura McGeorge with St. Luke's Health System says most of the COVID patients in the hospital are significantly younger compared to any other time during the pandemic. And the concern is not necessarily about space, but resources.
It's not just room and physical space. We now have to find extra intensive care doctors, extra respiratory therapists, and extra critical care nurses to fill a unit that we never even had before.
In late June, the state was reporting almost 200 ICU beds available. Today, there are only 90 left, a trend sending us back in the wrong direction, with a future looking not so bright.
What is really striking to me is that situation, seeing that, knowing that, hearing what is going on at St. Luke's, all the work to try to respond to this, and then walking out and seeing things going on that are as if there were no pandemic. I am completely confident that this is going to get worse before it gets better, because based on seeing what we're seeing with community spread and what is going on right now in our communities.
That comment says a lot, because of her walking out, as you said, and people act like nothing's going on. But the question remains, we've kind of seen this on social media, that some local hospitals are diverting patients. When is it going to come to that at St. Luke's?
Well, that is the golden question, and it's one that's really hard to predict right now. And that's simply because the number of ICU beds available changes every single day. So for instance, someone could be discharged, but several more COVID-19 patients could check in. So it's really hard to know exactly when patients would need to be diverted out of state. But like we heard today, that's been done before, and they have met capacity several times in this last month, so it's a wait and see.
But like that chart said, the most ever in Idaho hospitals right now in just weeks amount of time, whereas before it took like a couple months to get like there. All right, thank you, Katya.